Scott Mato is 8 years old. For years, he's suffered from periodic seizures that went undiagnosed and untreated until he came to GRMC.
A counselor or a nurse at school noticed that he had some events that looked similar to what she thought might be seizures. So he was referred to the emergency room, and then the EEG was ordered from there.
James Alex is GRMC's EEG Technologist.
This is him, and we have this, he's actually moving here, and this is actually his EEG, and what this is showing is pretty much just spike and wave activity all the time, which is indicative of some type of either epilepsy, some type of seizure activity, or just some type of dysfunction of electrical distribution in his brain.
And what did you do when you saw that?
I immediately contacted the doctor, our neurologist, Dr. Hale.
He actually came and got me. He said, "You got to look at this," because basically the child was having continuous seizures, and so I would classify it as him as being epileptic. And surprisingly, he was kind of looked awake, and he was able to follow commands, but I knew something was definitely not right.
That prompted Dr. Hale to hook Scott up to a longer-term Nautis EEG machine, dubbed Bumichacha by the neurology staff. That's Chamorro for a hardworking gal. The 8-year-old spent 5 days in our pediatric unit last month, wired almost continuously to Bumichacha and constantly monitored.
What we found with the long-term EEG monitoring over the course of a day or two was that he was really having seizures mostly during sleep and not so much during wakefulness. During wakefulness, his brain really looked like it was functioning normally. And so this is a category of epilepsy called ESES. It's called electrical status epilepticus of sleep. And there's one particular type of ESES called Landau-Kleffner, named after two doctors, Landau and Kleffner. And this particular type of epilepsy can interrupt circuits that are important for language function.
Scott had struggled for years, unable to produce words. He could comprehend and follow commands, but forming and speaking words have been beyond his reach. How rare is this type of epilepsy?
Very rare. It's maybe around 0.2% of all epilepsies are Landau-Kleffner, so quite rare.
How long has this child been suffering from this?
Yeah, that's the thing. It's probably since a very young age, maybe since birth. It's a little unfortunate that it was discovered so late, but it's not something that people tend to look for. It's so rare.
But now, having diagnosed Scott's condition, Dr. Hale was able to treat it effectively.
My hope is that now that we actually have suppressed the seizures with a series of medications, and my hope for him is that he will now be able to, without those circuits being interrupted by constant seizures, he'll be able to now relearn or learn language.
I was blown away by how well Dr. Hale handled the situation and how well he got it under control. The seizure ratio from the time he came in to the time he was released was just absolutely amazing. And over my 20 plus years of experience, this has been one of the cases that has really been most rewarding, and especially seeing the outcome.
And I hope to follow up with him in clinic and make sure that he's doing well and getting the speech therapy that he really needs.
So the prognosis is good as a result of the treatment?
I think so, yeah.
To make an appointment with Dr. Hale, call GRMC's Neurology Department at 645-5500, extension 4935 or 36.